Inspection of lymph nodes. Number. In most cases, only one area of node swells at a time. When more than one area of lymph nodes is swollen, it's called generalized lymphadenopathy, which is seen in infections, such as streptococcal sore throat and chickenpox, immune system diseases, and cancers like lymphoma. The position gives an idea as to which group of lymph nodes is affected, and the diagnosis. Hodgkin's disease and tuberculosis affect the cervical group. Filariasis and lymphogranuloma, inguinally affect the inguinal group. Secondary stage of syphilis involves the epitrochlear and occipital groups. Size. Normally, nodes are usually less than ½ inch across in size. It may be described by the patient as the size of a small pea. When enlarged, they can progress extensively, sometimes even to the size of a golf ball. In tuberculosis, lymph nodes attach together and are referred to as matted lymph nodes. These present as massively enlarged swellings, but are often distinguished from a single lymph node by their lumpy or matted feel. A smooth surface is seen in solitary benign enlargements, commonly seen with local infections of the ear, salivary glands, or oral cavity. An irregular surface is seen in malignancies. The lymph nodes are hard and have irregular margins, easily distinguished from benign enlargements. In acute lymphadenitis, the skin becomes inflamed with redness, edema, and brawny induration. Skin over tuberculous lymphadenitis and cold abscess remains cold, in the true sense, till they reach the point of bursting, when the skin becomes red and glossy. Over a rapidly growing lymphosarcoma, the skin becomes tense, shining, with dilated subcutaneous veins. In secondary carcinoma, though the skin remains free in the early stage, it is fixed to the swelling at a later stage. Ulceration and scarring is also not an uncommon finding over lymph nodes, especially ones that have burst. Pressure effects. Edema and swelling of the upper and lower limb occur due to enlargement of axillary and inguinal groups of lymph nodes respectively. Nerves may be involved due to enlarged lymph nodes. The hypoglossal nerve is involved with an enlarged upper group of cervical lymph nodes due to Hodgkin's disease or secondary carcinoma. Dyspnea and dysphagia may be complained of due to pressure on the trachea and esophagus respectively. Venous engorgement of face and neck may occur due to the pressure effect of lymph nodes at the root of the neck. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.